Many people with uncontrolled high blood sugar find that they're hungrier than usual, which signals a symptom called polyphagia. Medline Plus notes, and although you're eating more, you may be losing weight for no apparent reason if your blood sugar levels are too high. Since your body is not getting energy from the preferred source, glucose, it has to turn to muscle and fat. When your body starts breaking down muscle and fat for energy, you experience unintentional and unhealthy weight loss. In addition to these changes in weight and appetite, you may notice weakness in your muscles and experience more frequent falls. So before we get started, make sure to hit that like button. Subscribe to our YouTube channel for our future updates. You feel tiredness and fatigue constantly. Fatigue and extreme tiredness are symptoms of uncontrolled blood sugar, the ADA says. Simply put, when your body is not processing insulin properly or it doesn't have sufficient amounts of insulin, the sugar is staying in our blood rather than getting into our cells to be used for energy, Zanini says. Also, frequent urination can lead to dehydration, which Bandakwala identifies as another contributing factor to fatigue. You have noticeably blurry vision and frequent headaches. You may notice that your vision isn't as clear as it used to be, and that things may appear a bit blurry. High blood sugar levels can lead to swollen lenses in your eye from fluid leaking in, according to the Joslin Diabetes Center in Boston. This changes the shape of the lens, which makes it unable to properly focus, causing blurred vision. You may also find yourself struggling at work, having difficulty driving, and suffering from frequent headaches. You develop sores that tend to heal more slowly than usual. Cuts, scrapes, bruises, and other wounds heal more slowly in the presence of uncontrolled blood sugar, according to the National Institute of Diabetes and Digestive and Kidney Diseases. Diabetes causes nerve damage and affects circulation, especially in the lower legs and feet, which can delay healing because there isn't enough blood flow to the area. Even minor wounds are more prone to infections, which can become very serious and even result in amputations of the foot. You may notice drainage seeping onto your socks or an unpleasant smell if you develop a foot ulcer, notes the American Podiatric Medical Association. You may notice tingling and numbness in your hands or feet. As mentioned, uncontrolled blood sugar can cause nerve damage, also known as diabetic neuropathy. What you may notice is a tingling sensation or even numbness in your hands and feet. Some people experience pain in their hands and feet as well. Though neuropathy is most common in people who have had diabetes for a long time, it can occur in anyone with poorly controlled diabetes. You're developing blisters, dryness, or other skin changes. Small pieces of extra skin, called skin tags, may form in the creases of skin, especially if you have diabetes and you're trying to find ways to manage your weight, notes the ADA. Dark, thick areas of soft skin, called acanthosis nigricans, may form on the back of the neck or hands, armpits, face, or other areas. These can be a sign of insulin resistance, Zanini says. Blisters, infections, dryness, itchiness, discolorations, and abnormalities of the skin can all be warning signs of high blood sugar. Check with your doctor if these skin changes develop. You're getting yeast infections more often than usual. Hyperglycemia may lead you to get more frequent genital yeast infections. The culprit is often a type of yeast, a fungus, known as Candida albicans, per the ADA. According to the Centers for Disease Control and Prevention, in females, the symptoms can include vaginal itching, redness or soreness, pain during sexual intercourse, pain or discomfort during urination, and thick, abnormal vaginal discharge. While yeast infections are common in people who don't have diabetes, having more glucose in your blood puts you at higher risk of getting them. The yeast feeds off the glucose, and if your blood sugar is high, there's more glucose in the urinary tract, explains Bandakwala. Uncircumcised men with hyperglycemia are also at risk. That brings us to the end of this video. What do you think of our video? Let me know in the comment section below. If you enjoyed the video, make sure to hit that like button. Subscribe to our YouTube channel for our future updates. Thank you for watching.